So thank you for recording this. So yeah, I do want to let everyone know that this is going to be a recorded policy brief, and really, so I will introduce myself to you again. I think I've met most of you before, but my name's Annette Marcus, and I use she, her pronouns, and I work with the Oregon Alliance to Prevent Suicide, which is an advisory group to the Oregon Health Authority, and we provide recommendations on policies to OHA. And I always feel in these spaces of policy briefs that I am learning along with all of you. And so what I am going to be doing today is sharing with you just some information I've gotten about a couple of things going on federally, share some highlights from this last session, and a few things about how some of the funding is going to impact our community mental health programs, and close out from there. Next slide, please. Yeah, so and I'm going to end with some LGBTQ policy updates because I think there's some really interesting information that has come out recently. So let me just encourage any of you to, if you have questions or specific things you're wanting information about, to go ahead and put questions into the chat. And I'm also, I really do think of this as a policy chat. So if you have a question, please feel free just to raise your hand and ask. And if I know the answer, I will share the answer. And if I don't, we can put it on our list of things to continue to do research on. So next slide. So I think one of the more important things in our world of suicide prevention that's come out recently is this press release from the American Foundation for Suicide Prevention about some work they have done with the Federal Communications Commission. And I don't know if you all have been hearing about this, but one of the challenges with 988 is that right now 988 is routed. It's routed from whatever phone number, the area code of the phone number on your cell phone, which of course these days does not really route people to the folks who are nearby them. And so this piece of work is really around getting the technology in place and the laws in place so that the 988, when those calls go out, they'll be directed to where somebody is geographically rather than associated with with their area code, which I think is going to really be helpful in terms of us having more localized kind of responses. Any other information about this that folks who are on have or want to add into the picture? No. Okay. I don't know when this is coming into, I don't know when this will go into action. I imagine it'll be another year or so before they'll actually be able to make these shift overs. Next slide. The second thing I wanted to share, I think it's, as we watch federal news, so much of our news has been focused on presidential elections, et cetera, that it's easy to lose that anything is happening at a federal level. And so it was helpful for me to go back and review that there really are some investments that have come forward nationally for mental health. And NAMI National did quite a nice job of summarizing these. And I'll just go over that. Actually, federally, the National Institute for Mental Health has seen a $75 million increase to advance research into mental illness and discover innovative treatments. And I'm certainly hoping, and I think that one of the areas we'd want to continue to press is that some of the research that they're doing, or that they really have a focus on moving the research from kind of white dominant culture to really ensuring that we're looking at how treatments are working in a whole variety of communities. is a total of 519.6 million being invested for 988 and crisis line, which included an $18 million increase from the previous year. There is a $2 billion increase for Veterans Affairs, mental health, and suicide prevention programs. And I think those are dollars that we may see in Oregon in certain ways over time. And I want us all to keep an eye on that for suicide prevention work. Oregon already has had money from the CDC that has come into Oregon to support some efforts around suicide prevention and veterans. But I think that this will be opportunities for there to be more specific work. And one of the things that we have that's very interesting about doing work in this space in Oregon is that we're one of the only states that does not have a large military base of any kind. And yet we do have a very large population of veterans and especially people who've been in the National Guard. And so we really need to be sure that support happens here. This one I don't know as much about. $20 million in new funding for Law Enforcement De-Escalation Training Act. And that's just something I'm going to follow and continue to learn about. And if any of you know much about it, I think it's interesting, but clearly the focus of that is really trying to avoid these situations where when law enforcement is called in during a mental health emergency, that things are escalated in a way that ends up with people being hurt. So that'll be interesting to see what the feds actually roll out around that, or if they look to state programs to implement that. And then the last one I think is incredibly important. And this is a new requirement that states put into place a process to suspend Medicaid benefits for people who become incarcerated, as opposed to terminating benefits. And that may not have been as relevant to Oregon. I don't believe we're one of the 8 states that does terminate benefits, but I think it's a very important thing on a federal level that becoming incarcerated is not going to cut off people's ability when they come out to get Medicaid funding. So those are some sort of big high-level federal initiatives that are happening and we're keeping an eye on. Next slide. I think as probably you've heard, there was a $376 million investment in housing this short legislative session here in Oregon. The governor had actually asked for $600 million originally. I have an alarm going off in the background, just a moment. Okay. The governor had asked for $600 million initially, and 376 million was passed, and it was very much a bipartisan passage of these $376 million, and really both sides of the aisle lined up to talk about the ways they supported this. I think just a reminder that supporting basic needs is suicide prevention work. We know that lack of housing and not having access to housing is a huge risk factor and increases suicidality and other mental health issues. And the other thing that's kind of exciting about this particular set of bills that passed is there's really some targeted funding in it for people of color and LGBTQ2SIA people who are overrepresented in Oregon's houseless and low-income committees. Next slide. Two pieces of legislation that we were very active on, the Oregon Alliance to Prevent Suicide. And, you know, I'm looking around this room and I think I know all of you here. And so I haven't done a lot to explain who the Alliance is. But we worked really hard to try and get House Bill 4096 passed. this year. Representative Tran was the main sponsor, and this particular bill would have clarified FFLs, which are federal firearm licensed organizations. It would clarify that when they are holding, if they hold a firearm for somebody in a crisis situation, they do not become liable if they return the firearm to the person and something bad happens. And this has been kind of a major stumbling block for us in really some innovative work that's happening around the state around trying to work in partnership with federal firearm licensees to hold firearms, especially important for firearm owners who may not have family members or trusted people close by that they can leave a firearm with. That a lot of times going to one of these FFLs would be a better option for them. So we're quite committed to recommending this again next year. And I believe there'll be a different kind of venue to ask for support for it around, which is with this new Senate Bill 1503 that has passed, which is for the Task Force on Community Safety and Firearm Suicide Prevention. And this was a key priority for President Wagner, and included in the bill is coordination with the Oregon Alliance to Prevent Suicide. And that task force is newly getting stood up. I just yesterday received notice about applications that they're accepting applications for people to apply to the task force. And I think it would be very helpful to have somebody from our Lethal Means Committee on that task force, since that group has been working so hard on having really kind of a cohesive plan to addressing access to lethal means. I'm going to just pause here and ask Jen if you have anything you want to add, or any of the rest of you who are here who actually worked on some of this firearm legislation.
This is Jen. I don't have anything to add. I feel like you covered that really well, and we'll keep you all updated as the upcoming long session comes with what future legislation on safe storage looks like.
You know, the one other thing I forgot to add there is that right after the session, there was it was called a summit on safe firearm, or a roundtable on safe firearm storage that we were invited to, along with a number of other legislators. And I was very encouraged to see there were about 80 people who came to that. And I think they were from a wide range of perspectives. So it seems to me like there really is some kind of energy and volition at a statewide level to begin to address some of these issues around firearm safety. And one of the things I am just repeatedly hearing from colleagues in suicide prevention around the country, and we've heard it directly from firearm owners in our state, is that the way we talk about this is really important. That firearm owners very much want to prevent people being harmed by firearms. They want to prevent suicide, etc. And so talking about this as firearm safety rather than as stopping firearm violence is much more palatable way to frame it for people who actually are gun owners, which is a group that we very much want to reach in our messaging about suicide prevention. So that's just helpful kind of context to know. I'm just curious, are there any of you here who might be interested in applying for being part of a governor's task force on suicide prevention and firearm safety?
What's the commitment look like, Annette?
I am guessing it's going to actually be, you know what, Leanne, it's a good question. I don't know exactly. And so I will ask them to find out more. I kind of think there'll be a bit of a time commitment on this one, though, because I think that the goal, it's a time limited task force. It's not in perpetuity. And so they're going to really be, I think, working on trying to pull together maybe some proposals for the long session, which is only it's in 2025, so it's coming soon. Yeah.
I would
All
be
right.
interested in just hearing more about it before giving a definitive yay or nay.
Okay. Thanks, Leanne. It's good to know that you're an option, and maybe we can just invite you to our lethal means safety group, no matter what, too, if you've got some interest in that area.
Annette, this is Cindy Guy from Samaritan. I would like to consider that as well, given the time commitments.
Great. I'm sorry, I didn't hear who that was.
Cynthia Dye.
Oh, hi, Cynthia. And Cynthia, do we have your contact information?
I don't know that you do. I'm happy to put that in the chat.
Yeah, would you mind I mean, if you're not comfortable sharing it with everyone, sharing it with me and
I don't mind at
Jen.
all.
Great. Okay. Next slide. And thank you, folks, for your interest. I think this is going to be very important and interesting work. Another key piece of legislation that the Alliance worked on with the last session was around getting additional funding for school-based health centers. That was House Bill 4070. We were disappointed that the full bill did not pass, which was actually going to bring in about another $1.5 million, and it was going to include some capital construction for some new school-based health centers. Instead, about half that amount got through this time in legislation. But I know that the School-Based Health Alliance is going to plan on submitting another version of this bill next time. And part of why the Alliance has really focused on these school-based health centers as such an important area for us to support funding around is that there's actually some very direct data that shows suicide rates are lower and suicidal ideation is lower in the schools that have school-based health centers. And we also know that school-based health centers play a really crucial role in that idea of sort of young people being able to find that right help at the right time. So keep an eye out for this next time. And we're going to be hearing in more detail about this work tomorrow at our schools committee. So if anyone wants to learn in more detail from Maureen Hinman, who's actually the executive director of the Oregon School-Based Alliance, just send me or Jen an email, and we'll be sure to get you an invitation to that meeting tomorrow morning at 8:30. Next slide. Okay, so this last piece is, I guess it's my second to last piece. This is where I'm going to share information with you from the Association of Oregon Community Mental Health Programs, which I think I know most of you know is where the Alliance lives inside of. And the community mental health programs saw some very important funding this session, and they're important ones for us in the suicide prevention world to kind of keep an eye on, because they're the entities that are responsible for planning and delivering of services for individuals with substance use or mental illness diagnosis operating in specific geographic areas through a county financial assistance agreement with the Oregon Health Authority. Now, that does not trip off the tongue, but the reason I included that in here is I think that sometimes it's easy to forget that every county has a community mental health program that has these very specific statutory kind of responsibilities to support people that may not have access in any other way to behavioral health supports. And one of the things about Oregon is that it's not a state administered system. There's funding comes from the state, but each county is set up a little bit differently in terms of how they administer these programs. Some of them are done through nonprofits, some are through a county department, and but all of them are are responsible for the same set of financial agreements. Next slide. So one of the big things that passed this session that I think has a lot of promise is, for the first time, the Oregon Health Authority has been asked to really do a thorough cost analysis of what the community mental health programs cost. And, you know, there's been this narrative for a long time that behavioral health has been underfunded in Oregon. And I think it's been very frustrating for the general public because they keep hearing about new investments in behavioral health, and they're, you know, and yet they are facing long waits to get into therapy and that kind of thing. And I think we know that part of this is the workforce issue. The other is that we believe, most people I talk to believe, that we've been really underfunded for years. So that part of what's happening is that we're really kind of bringing our floor up to the level of some other states. But what there has not been is a super clear estimation of what does it really cost to do what our community mental health programs are required to do. And it's a complicated enough question that they're going to take the I'm sorry, I'm losing my voice here for a sec. It's going to say a complicated enough question that they're going to kind of do this in stages. And the first stage, which will be due January 1st, 2025, will focus on what are really kind of, sometimes we refer to them as the deep end services of community mental health programs, but it's tends to be very high intensive costs and needs, and they're around civil commitment, aid and assist, and crisis services. There will additionally be something that you may hear referred to if you run around in state circles as the TAB 2 work group. And that is really looking at tackling administrative burdens. And it's looking specifically at what I think some folks think may be redundancies in some of the administrative rules and requirements, and really trying to work to clarify everybody's roles. And I, you know, part of what's happened, just my when I moved to Oregon in 2013, and it's the CCOs had just been set up, and the county behavioral health system was really changing at that time. And what I've seen in these 10 years is there's been a lot of kind of shifting and trying to understand how CCOs, CMHPs, our state system, the ways that they can interact and intersect most effectively. And I think continues to be an evolving situation. And part of the work of this TAB group is really to look at, do the administrative rules and regulatory requirements make sense given where we are now and how all those different pieces fit together? Anyone here who knows about these particular efforts, who wants to add anything in about that? No. Okay, I think this is going to be really interesting for us as a field in terms of thinking about what it is we need to be advocating for, or educating folks around. Next slide. However, I don't want to underestimate the celebration that there was $85 million were added to mental health treatment beds this last session. And as Cheryl Ramirez from AOCMH says, we're grateful for the additional funding for facilities because we desperately need places for people to be. The OHA has estimated there's approximately 3,000 additional facility beds that we need for people with behavioral health needs in one way or another. And there were many sites across the state that were funded for building, etc. Happy to send out a list of those sites. Last I heard, we were still waiting for the governor to sign off on all those pieces of funding, so I don't think they've been finalized. However, there is this huge challenge of there's some funding for building more really crucial services and we've got this behavioral health workforce crisis across the state. And I think that's just going to continue to be a challenge for us. And a message that we're going to need to continue to share out is that we need to be creative in all the different ways around how we bring people into this field. And I know there's people talking about different efforts. There certainly is a lot of folks looking at pre-service, meaning pre-baccalaureate kind of degreeing out, or getting people trying to move towards having some bachelor's degrees that could qualify folks to do some of the behavioral health, fill in some of the behavioral health gaps that are there. But this is one of these, I think, long-term knotty problems that we're all going to be looking at different ways to unwind over the years to come. Next slide. So as many of you probably heard, there was a lot of discussion at this session about what was happening with Proposition 110, which was the proposition that changed the laws around having small amounts of marijuana. Well, no, the marijuana rules haven't been affected by that, but small amounts of substances. And kind of the way these changes in this have been talked about in the media is they've basically said drugs got recriminalized. And actually what happened was more complicated than that. What happened is that a number of items, now there can be a misdemeanor charge attached to holding certain levels of drugs, but there's also some diversion options. And these diversion options involve both the community mental health programs and our justice system folks. I think it's interesting that the Association for Community Mental Health Programs didn't take a position one way or another on the criminal penalties portion of the bill. And I believe that was because there probably was not a consensus amongst community mental health directors around the state. It is a bit of a concern that out of the $220 million allocated for Measure 110 reform, only 10 million were allocated for efforts to expand the workforce. There were, however, a number of associated direct appropriations for community mental health programs that you will be seeing in your community. And so $7.5 million for community restoration, 9.83 million for jail diversion. So that, again, you can see goes directly to that, having alternatives. There is, in terms of that $10 million that went to workforce investment, the two ways that's moving forward is $4.7 million for United We Heal apprenticeship, $4 million for public universities to do more behavioral health training. I know from the perspective of the Association of Oregon Community Mental Health Programs, we're very excited to see CCBHs, which are community clinical behavioral health county community. Oh my gosh, I can't get all the letters. If one of you can get the letters for me, but basically what they are these wonderful integrated clinics that have both behavioral health and regular health services brought together, and have really been very effective in working with community members. And so there is expansion for that. And then $85 million of the funding is going to crisis receiving stabilization centers. Sandy, thank you. Certified Community Behavioral Health Centers. I hate it when I can't get an acronym out of my mouth. So that's quite a bit of new investment. And it's that set of $85 million. If you want to know like where exactly those $85 million are going, I'm happy to send out a follow-up list to you if you just send me an email. As I said, the governor had not signed that the last I heard, and so I don't want to send out anything that there could be some shift in. Next slide. So I just want to take just a moment, because when I hear jail diversion, I'm not sure what it is that's being talked about. And you'll also hear the word deflection. And this is a word that the justice system's using a lot. So they're saying deflection out of the justice system. And so if you look at this chart on the far left where it says intercept 0, this is basically the whole set of kind of crisis services that are there when somebody comes forward in crisis. And this lays out, when does law enforcement get involved? And so you can see at intercept 1, if the call goes to 911, it could be that local law enforcement's called, but you see this two-way arrow here. Could be that local law enforcement actually then calls out the mobile crisis team that goes out. But in this whole area, they always will be trying to first use these existing kind of array of services and supports before detention. But the thing about all of these supports is they are all voluntary, right? So detention can happen if somebody who is arrested with a misdemeanor amount of drugs on them does not agree to using any of these diversion or deflection systems. And then what happens is you do move back into the law enforcement system again, and jail, court, parole, that cycle. And so I think that there's going to be a really important role for any of us who are working with folks who are likely to find themselves caught up in this early part of it, to help them to understand what it means to accept or not accept some of these early treatment services and support services that are offered. I am definitely not an expert in this piece, but I felt like this was a useful kind of chart. And if any of you have, want kind of deeper information about this whole system and how it's being set up, I'm happy to connect you up with people who are much more subject matter experts in the area. Any comments or questions about this? Okay. Move on to the next slide. Just to note, the idea of the interaction between law enforcement and behavioral health is really complicated and is viewed in different ways in different parts across the state. But we just wanted to be clear that inevitably the community mental health programs do intersect and work with law enforcement in a number of different settings. And these are some of the settings they do, but that it's also incredibly important that they are also working with certified recovery mentors and other peers, and contracting with peer-run organizations like Oregon Family Support Network and et cetera, to do outpatient navigation, et cetera. So just to have a little bit of a picture of some of the networks that are at work as people come in, if they are in a deep end crisis to our system. Next slide. Along with those bills, a couple of other bills that passed that are going to impact our community mental health system is one that establishes a new framework for emergency response systems. emergency management system. And that's going to be relevant to all of us because of the work that we do in 988 and crisis response. So that'll be another advisory board that if folks are interested in, once we find out when and where that's happening, we'll let you know about it. And NAMI and AOCMHP were very involved with this to really try and ensure there'd be some meaningful participation by people who are actually working in those systems and know some of the challenges in them. The other piece, I don't know if any of you have experienced this, but you know, there has been these chronic long waits for getting background checks back as we try to hire people into positions. So the second bill, which is called the Wrap Back Fingerprint Retention Background Check Bill. Basically, my understanding of this is that Oregon is one of a few states that did not have an official setup with the FBI where they are able to communicate with us quickly back and forth. So this took care of whatever the legislative kind of barrier was to that. And we are hoping that in the next year, this is going to really increase the speed with which we're able to get information from the FBI for these background checks, which then should speed up the way the state agencies are able to get back to all of you as you try and hire new employees. So I'm hopeful about that one. Next slide. Okay, I'm going to switch gears to talking about some national stuff and how it kind of lands here in Oregon. But I just want to pause and see, are there any comments, questions, or things people would like to add from your systems about sort of what you have seen this last legislative session and what you're interested in around behavioral health and community mental health programs? Okay. So this last piece I wanted to frame up, if you've been part of any of the work that the Alliance has done in the last few years, you know we've done a lot of work in the area of really working to try and support affirming environments for LGBTQ youth. And this very interesting study just came out literally at the beginning of this month that took a look across the country at the states that had laws in place that clearly identified sexual orientation and gender identity in their anti-bullying laws. And you can see from this map, these ones in maroon are the states that have that, and Oregon is one of them. And what this national study found is that overall, they sort of looked at suicide rates across all of these states for young people. Suicide attempts were 18% lower when states clearly included sexual orientation and gender identity in their anti-bullying laws, which really goes to support the work we've been doing around affirming and the work that's already happened in Oregon to have these laws. It's interesting that this study also said that states with more gay-straight alliances have lower rates of physical harm and suicide to LGBTQ students. Next slide. So I wanted to just relate this to kind of our last session here in Oregon, where we've continued to, one of the things that happened is there were 4 really very kind of discriminatory anti-LGBTQ bills that were introduced at the session, and they didn't get out of committee. And I think that really speaks to the level of support that there is within the state legislature and the understanding that supporting LGBTQ youth is suicide prevention, and supporting LGBTQ people is the right thing to do. I think it's easy to lose the bad things that don't happen, but just keep our eyes on the rest of the country. There has been so much anti-LGBTQ legislation passed. The fact that that we've really not done that here, I think is really significant. There's there were several items that did pass. These were not things that the Alliance specifically worked on, but I think are very interesting for us to look at. The first one is $4 million for a second Prism Health LGBTQ Health Center in Portland. And I think that is probably increasingly important as Oregon's actually become a destination along with some of these other states that are protective of LGBTQ youth, for young people and their families who are escaping states where their young people's identity is really being attacked. Very interesting, this $1.25 million for the Queer Data Project passed. And this Queer Data Project really is people across the country have their eyes on it. It aims to collect accurate and comprehensive information about LGBTQ2 Oregonians' lives and needs. And so we'll have, because there's a lot of problems with the way this data is collected already, not just here, but across the country. And you can imagine it's complicated collecting that data, because when do you ask for that information? When are people willing to share that information? How does it get passed on? And so this particular initiative is really taking a deep look at ways that we can better understand what is going on in these communities. And I think will probably become something that the rest of the country will look at to learn about. Just for a note, data accuracy about groups that may be underrepresented in data has been one of the areas that the Alliance has been focused on. We also really want to support efforts to be sure we're really looking at all the different ways we're collecting data about people of color and immigrants and people who do and don't have citizenship or residency, etc. The last piece on here, this is not specifically for LGBTQ youth, but it will really impact them positively, and it impacts a very vulnerable population. So an additional $1.8 million was designated for treatment foster care in Oregon. And I think treatment foster care is such an incredibly needed and important program for youth who have really experienced some of the most difficult and challenging situations in the state. And it provides additional support both to the foster families and to the young people who are engaged in the foster system. And a disproportionate number of those we know will be LGBTQ, queer, and trans youth. Next slide. I just wanted to give you the kind of the notations for where I pulled some of these stats, and share with you that I see that we've got a couple of you that work in the schools. So I'm thinking Paige and Mary, I see you both here. That I think it's really interesting. The thing that this study looked at was, in some ways, they found more than training teachers, more than training staff, that actually having along with having these anti-bullying things that makes it very explicit that part of it's considered bullying to tease people about their LGBTQ identity, that the other thing was having a GLSEN of some sort, having some kind of gay straight alliance or GLSEN. I don't think it mattered what kind, but having that kind of active presence at the school, which I think is just an interesting thing for us to be thinking about as we think about what we want to be trying to support in terms of suicide prevention activities. Was that my last slide, Jen? I have a feeling it might have been. No, this is one more. And I just wanted to say, keep an eye out for the 2025 session. there was a bill introduced this last session that actually would have made it illegal for schools to implement one of these bans on books about Black people, about slavery, about LGBTQ people, some of the book bans that we've seen in other states like Florida and Texas, etc. So this bill directly addresses that to try and protect that. There hasn't been a movement for that to happen on a statewide level, those kinds of book bans. But if you watch the news, there's been a lot of activity locally around book banning in libraries and that kind of thing, school libraries. So this was an attempt to try and address that. It didn't get through the session. I'm not quite sure why it didn't get through. You know, a short session is very short. I do know that there is a group that is a partnership, I believe, between Basic Rights Oregon and Planned Parenthood Oregon. And there's a third group that might be part of it. It might be Lines for Life, but I'm not sure about that third group. That is looking at putting something onto the as a ballot measure in the fall that they would call the Equality Amendment. And it basically, this is just in the formation, so I don't know a lot of details about it, but it basically goes through the Constitution, the Oregon Constitution, and addresses areas of the Constitution that are kind of older laws that may have outdated language about marriage being between a man and a woman, and you know, language around access to care, etc. So I do think it's interesting that LGBTQ issues and reproductive issues are increasingly being addressed together in bills. And I think that's an interesting thing for folks to think about in terms of, I don't know, it's just kind of a new political development that I find intriguing. And I think it's because so this is a net opinion as opposed to anyone else's fact. I think it's because so much of what's happening in the LGBTQ space right now, in terms of anti-LGBTQ work, is around healthcare and healthcare access, and the reproductive rights movement is very much around healthcare access as well. And so there's really becoming a rallying call around healthcare access for all, and everybody have access for care for their own bodies. So though that's my kind of whirlwind tour through what I saw and have heard from various people as highlights from the last session. Curious if folks have any questions or anything that struck them in hearing about these different efforts. I did include a little bit of information about the Queer Data Project, which we can send out with you. If you would like to get a copy of this PowerPoint, please put your email into the chat so that we can know to send it out to you. And this is just a couple of slides about the DD-IDD system. And I honestly am not going to speak to you about them. I probably should have pulled them out because I really do not have a depth of understanding, but I can tell you just a very high level. There was some funding rebalance in the DD-IDD sector, but not as much as anyone wanted. Oh, Lucas, will you say a word about the Queer Data Project? I didn't realize you were here, and I'd love to have you speak. This is one of the key folks working on that.
Yeah, no problem. What would you like me to share?
Well, maybe share who's going to be kind of spearheading those efforts, and what people should do if they would like to be involved in any way.
Yeah. So this project has been in the works since I want to say early 2021. And the design team is a mixture of community-based activists, folks with lived experience, professional researchers, and folks with academic backgrounds. And everybody that's part of the design team is a member of the LGBT community. We are getting close to the closeout phase of closing out phase 1. And so now in phase 2, we're hoping to fill gaps in representation. Would really love to have more participants and voices from Eastern Oregon and the greater Oregon coast. We have representation in the coast, and then from tribal nations as well. So we're wrapping up phase 1, and then we'll be doing a recruitment to add more people to phase 2. And what's really interesting and different about this project is that the body of work is decentralized from any one organization. And it's actually a body of work that will be held by the community for the community, because we know, historically speaking, data that's been collected on behalf of our community has often been used in ways to further oppress us. And so we designed a process that would allow the information to stay held within the community. And we've gotten a lot of support from folks statewide. We'll be launching a more official website probably in the next month or so. But I did put the email to reach out to us that if you want to learn more or you want to get on the listserv to become a friend of the project and get updates as we roll out different aspects of the project. But in whole, this will be a multi-year project where we collect data around the state, working with folks locally to do place-based efforts. And the final deliverable will look a number of different ways. We're envisioning that we'll have oral archives as well as survey data and kind of data points that can be used to further push along different policy and that kind of thing, but then also creating interactive tools that work for the communities that we're serving and collecting data on. So we expect that it'll have a variety of different deliverables that are available in different languages and different modes of accessibility for folks depending on what they've got going on. But yeah, I think that's like the broadest kind of description that I can give y'all, and feel free to reach out if you want to learn more or get involved or give us money because we've been able to raise quite a bit of money, but we're still, I think, a little over $300,000 short of hitting our goal. So if you or your foundation is feeling generous and wants to make a donation to help us meet our budgetary goal, you can also reach out to that for that, because we will gladly take any and all money that you want to share with us. So yeah, thanks.
Thanks, Lucas. And I just see, looking around this room, that there's actually quite a few interesting contacts here in terms of, I don't know if you and Rosanna know each other. I also think Mike James, who's connected in our whole veterans and military communities. And so, Rachel's connected to child welfare system. We just have a lot of networking out. So let us know if there are specific asks in any of those kind of communities.
I definitely will. And then, we've had folks reach out with different interests. For example, some of our project partners on the LGBT advisory that work at Oregon Department of Education. And so we're happy to meet with folks to kind of strategize around data gaps that you might be having as it pertains to SOGI. So SOGI is sexual orientation, gender identity. So if folks want to reach out and kind of talk to us about what you've got going on, another big element of the project is capacity building and helping folks get the resources that they need to get this data. So I'm definitely happy to continue the conversation with anybody that, any of this information sparked your interest.
Thank you. I do know that one of the things in the world of suicide prevention that we know is always complex is that so much of our information ends up depending on, about actual suicide deaths, ends up depending on medical examiner reports. And so there's a whole piece around whether medical examiners are effectively picking up on whether folks are LGBTQ and et cetera. So it's complicated. All right. Well, really, it was kind of remarkable that we've continued to have funds come through. Who knows what our next legislative session will look like. What I am seeing around the state is a lot of cities that are having, like I live in Eugene, and Eugene is having major financial issues. I believe Salem is also having major financial issues. I think that's another thing for us, all of us who advocate for state investment into our school systems and into our, social emotional learning and suicide prevention. Just know that I think next year there's probably going to be cities and counties also knocking at the door saying that there's a lot of need in those areas. Really appreciate you all taking time out of your day to come to this, and that's my update for the day.